Hi, I'm Jan, and I'm currently attending Leadership 620 at Grand Canyon University. And I would like to do a presentation on my strategic plan that I would like to implement in the Salt Lake City VA Medical Center, where I currently work as a registered nurse. We've had a large increase of patients that have been attending their outpatient clinic appointments get sent up to inpatient units to be admitted. And they've been showing up at the desk unannounced. They've been even placed in rooms and left there without any notification at the desk that we have a patient sitting there. This is creating a large liability for the VA system. When someone's ill, there is a potential that they're at risk for many things to happen and to be left unattended without giving us any the nurses or anybody notification can be dangerous. So part of the big problem is that people at the outpatient clinic don't have any type of plan in place that tells them how to proceed with an inpatient admit. So what I plan to do is implement a strategy and follow through with an action plan that can prevent these dangerous situations from happening where a patient could potentially die. Anyways, the first thing is to make sure that everybody gets trained and knows the steps. And that's all the stakeholders, everybody that's in the clinics, the doctors, the nurses, the clerks, right down to even housekeepers and our escort system, which are volunteers at the VA. The main thing is that once a patient is seen at a clinic and the doctor realizes it would be better for them to be admitted, there needs to be probably verification. So a doc-to-doc needs to be done to see if they do meet inpatient criteria. If there is any question, then the emergency room needs to be notified, and they will also be aware of this new admission process that we're going to implement so that an ER doctor can reevaluate the patient for admission. Once that has been proven, then the chief nurse of operations needs to be notified. And what has been happening in the past is this person has not been notified, and this person's vital to the operations of the hospital on a daily basis. They know how many beds are available, they know who's coming, who's going, they pretty much know everything that's going on. So the CNO needs to be they need to know that we're going to get an inpatient admit so they can find out if there's any beds available and if they meet the criteria of that unit. For example, could it be an ICU patient? Could it be a telemetry patient? Could it be just acute medicine? Maybe they only need to be on an observation. Maybe they need to be a full admit. The chief nurse of operations is the one that can verify and provide that information. Once that has been verified, then a doc-to-doc needs to be done to let them know we're going to be doing an admit on this patient. And then also the CNO will verify with that unit that they will be receiving an admit from the outpatient clinic. Once the unit has been verified that this patient will be coming to them, an ADT order needs to be put in place in the system. Now, all this information that's happening down at the clinic, what has been happening in the past, they have not been implementing anything in a computerized patient record system like they should be. The documentation's been very weak, and now we need to start seeing some changes. So we have better history, better documentation, better demographics, and better diagnosis on the patient at risk. Once this is all, next step would be to verify with a nurse that he or she will be taking a new patient, and then that nurse can call down to the outpatient clinic to get the information from the clinic nurse. And that information basically is everything they've just put in the patient record system. But we also need vital signs and the reason why this patient needs to be admitted, and important information that will help with the care of the patient. Then, now that we've got everything in place, we've got a room set up, we've got the doctor has been acknowledged, the nurse has been acknowledged, everybody's good with the information that's been received about this patient, then we can get the patient transferred. So rather than a patient coming up by themselves, they either need to be taken up to the unit by a medical professional from the clinic, or if the patient is not too ill, we could also utilize our escort system who have been trained. So regardless, there's going to be a formal transfer of a patient. Now, once we get the patient, it's easy to evaluate to see if the system is functioning as it should, and that's just by we get the patient settled, we get them in a bed, we get everything is in order. Doctor is now putting orders in, and there's not been any mistakes made in this transfer. So hopefully this will just give a better flow to the system. We'll have some rules and regulations in place, and it's not going to be any longer where a patient will be at risk of possibly even dying on their way walking up to an inpatient unit. So thank you. I hope you enjoyed this short little strategy plan that I hope to hopefully one day put in place. Thanks. Bye-bye.